Hi everyone, my name is Ashley. I'm the clinical lead here at Thorpes Physiotherapy. Today's video is going to be another FAQ video, so answering commonly asked questions by our patients, this time with regards to hydrotherapy. So we're going to be covering what hydrotherapy is, its backgrounds, what conditions may benefit from hydrotherapy, how hydrotherapy works and the advantages of hydrotherapy versus typical land-based exercises, what to expect as a patient, what's the experience like, can I still do hydrotherapy if I can't swim? And how's it going to benefit me in the long term? Also, we just cover certain areas where hydrotherapy might not be appropriate for certain patients. So hydrotherapy, also sometimes referred to as aquatherapy, is quite simply physiotherapy-led based exercise classes. It can be one-to-one or group-based classes in water, and the water is usually slightly warmer than your average pool temperature. And this is for several reasons. So hydrotherapy benefits. The warm water temperature can be really beneficial with certain conditions such as osteoarthritis or rheumatoid arthritis, where we know that joint pain can sometimes feel worse in the cold and damp and limit your ability to exercise. So the warm water can be therapeutic in itself. Number two, by exercising in water, we have more buoyancy, which means that we have more lift, which effectively offloads some of the joints. So if you're suffering with joints or chronic muscle pain, this can be really nice way to exercise. And patients will often find they can do a lot more in the pool than they can do outside of the pool. So this means that we can help to improve your range of movement in stiff and painful joints, so mobility, and also improving muscle strength. And now that moves on to point number 3 in terms of the benefits, is the added resistance of water. We can dictate levels of resistance utilising the pressure of the water and also certain devices such as pool weights, just to try and increase resistance on the muscles and again building muscle in a more comfortable way. So in terms of what kind of patients would benefit from hydrotherapy, so those with long-standing persistent conditions such as osteoarthritis, rheumatoid arthritis, psoriatic arthritis, or many more types of joint pathology, ankylosing spondylitis, which is a condition of the spine, or you may have chronic muscle pain. It may be fibromyalgia, and with fibromyalgia sometimes people struggle to do standard daily exercise such as going to the gym and lifting weights, so something more gentle like hydrotherapy may be more appropriate. So what to expect from hydro? So hydrotherapy, as I say, will be physiotherapy led. A physiotherapist will be poolside, so outside of the pool, giving you clear instructions on what to do throughout. We can tailor the exercises to you personally. So depending on your level of ability, it may be some very gentle exercises initially and then progressing these over a series of weeks. The benefit of hydrotherapy, where we run our classes, is that we run them from the Senses Wellness Spa in Yateley. So it's quite a long pool, but it's all the same depth and approximately chest height, obviously depending on how tall you are. So a big thing about hydrotherapy, a massive question we do get asked is, I can't swim or I'm not a strong swimmer, is it appropriate for me? The answer is yes. So as long as you don't have frank anxiety or massive phobia of the water, hydrotherapy is absolutely appropriate because, as I say, your head will be above water at all times, a physiotherapist will be there on hand, and you'll have guidance throughout. What about getting in and out of the pool? So at Yateley, our pool does have a few steps, but there is a handrail as you go in, and they're graduated, quite wide steps, so not too steep. And of course, the physiotherapist can assist you in and out of the pool. They do also have mechanical hoists for those patients who have very restricted mobility. And our classes are half an hour in duration, and we offer 2 types of class per week. We have the lower limb class, or the hip and knee class, and the spinal class. So hip and knee is tailored a little bit more towards those who have lower limb issues. So that could be hip, knee, ankle problems. Now that could be persistent arthritis, that could be after an injury, that could be pre or post operation, pre or post surgery. So if you've had a hip or knee replacement, fantastic way to get you on track, and in addition to your land-based exercise program, just to speed up your recovery. If you're about to have a hip or knee replacement, maybe there's a delay in having that operation, maintaining muscle mass and joint mobility is key, and that will give you better post-surgical outcomes. So the more muscle you can maintain, the more movement, the better. So this may be something leading up to an operation as well. So these are the kind of areas that hydrotherapy can be useful for. So what about the classes? So we've got the two classes. The spinal class is a bit more generic and involves upper and lower body type exercises. Now, because the classes are half an hour, we advise patients to arrive promptly, ideally 5 minutes before the class, already dressed ideally. So if you've got your swimming costume on underneath, bring a towel, bring water because it can get hot in the pool area, and of course bring all your medicines. So if you've got GTN spray for angina, if you've got inhalers for asthma, if you've got diabetic medication, if you've got an EpiPen for allergies, of course bring those along with you. And there's changing facilities on site, so you can have as long as you like, obviously, to get changed and make sure you're warm and dry before leaving the facilities. So I hope that gives you a bit of an overview of the advantages of hydrotherapy and what to expect. There are some patients, of course, it may not be appropriate for, so significant fear or anxiety of water, of course, is quite an obvious one. Chlorine or bromine allergies or significant skin conditions, fungal infections, active skin infections, chronic or severe COPD or unmanaged asthma. So there's very severe respiratory disorders. Sometimes the humidity and the chlorine can affect your breathing. So before referring you to hydrotherapy, we'd need to go through some screening-based questions, which will be undertaken by a physiotherapist. And here at Thorpes, we offer hydrotherapy on a private self-funding basis, so you can pick and choose when you come, and also on the NHS via our any qualified provider agreement with your GP. So yeah, I hope that's been useful, but if you do have any further questions and want to discuss whether hydrotherapy can be beneficial for yourself, please get in touch, and you can email us at admin@thorpesphysiotherapy.com, or alternatively give us a call on 01276 376 70, where one of our admin team will be more than happy to help. Thanks for listening.